Welcome everybody. This is Wellness Warriors. This is our first episode, so kind of bear with us. We're just getting into the groove of things. But it's a new podcast that we're doing through Rejuve Medical to kind of investigate a few different topics, things that are going to help you become a healthier you. So this is Shelby Deitchler.
Hi, everybody.
She's functional medicine specialist that we have working here at Rejuve, and myself, I'm Terrence Keller. I work in the ortho department, kind of working with chronic pain, joint pain, things like that.
So first, let's just hear a little bit more about you, Terrence.
Okay.
What do you do at Rejuve Medical?
All right. Well, what I do at Rejuve Medical, I work on the body. So, I mean, and more specifically, joints and pain. Mm-hmm. So, I mean, people will come in with pain almost anywhere, whether it be headaches, whether it be knee pain, hip pain, shoulder pain, back pain. I'd say some of the most common things that I see, neck pain, back pain, shoulders and knees. Everything else kind of smatters in there. Usually we'll get started with one person on a specific joint, something going on. We might start uncovering other pieces that are broken down and causing pain. When we think about the body, the whole thing is connected. So often you're going to have a problem in the knees or the hips that's going to affect the backs or vice versa. Mm-hmm. So we're kind of there to try to investigate where that problem is coming from, how we can treat it, get that pain under better control so you can actually move your body better to help control the pain elsewhere in the body and live a healthier life. A little bit about how I got here. Initially, I was an athletic trainer. So I went to college. I didn't know exactly what I wanted to do, but I knew it wanted to be medicine-based. Initially started kind of down a physical therapy path. I found out that I liked working with athletes more than I liked working with the older generation at that time and just PT. Yeah. And of course, everything kind of molds as you go throughout life and you discover new things. So I did athletic training for 7-8 years, and during that time of athletic training I did discover the PA path where I could continue on medicine, do more diagnostic evaluation. Hours were better, able to work with patients in a different way than I was prior. So I went to Augsburg College down in the Twin Cities, did my PA, and even when I started, it's like, oh, I'm going to do orthopedics. I know I'm going to do orthopedics. That's all I really cared about and wanted to really expand my knowledge. But once you go through that education process, you learn everything about the body and about how you can help people in multiple ways. So my first job was actually in urology. That one didn't last long, more so because of the...
Interesting. I didn't know that. Okay.
And it probably, I was even just talking about this yesterday with a patient, probably would have been where I would have ended up, because it was interesting. It was procedural based. I mean, a lot of surgery action and things like that, which is all exciting for a fresh grad. Yeah. But the doctor that I was working with, just really not a great doctor to be working with. Wasn't a great team player. Yeah. Didn't appreciate the physician assistant for what I can actually do. Okay. Kind of wanted me more as just a kind of someone to do the things that he didn't want to do versus actually being a kind of a partner in crime. Yeah. Or partner in practice. Yeah. So then, after my little urology stint, then I was in a walk-in clinic because they had the need there in the community where I was. And that was really rewarding, just being able to see what's going on in the community, and I was in a small community too. I think if you're in a larger setting, it's different. In that smaller rural setting, I was able to see you knew a lot of the people. I mean, and we all know that people use walk-in clinics as a kind of a bridge into their primary health care because it's difficult to make regular healthcare work. So I would be able to see what's going on in the community. I'd get my share of orthopedic injuries. We'd have cuts and scrapes and lacerations I'd have to open up or close up, and then people that had bigger emergencies that we'd have to get to the ER. So anyway, that was a lot of fun, great until COVID happened. And then COVID really changed just our whole environment of how that walk-in clinic worked, especially in a small town. So I went from seeing probably 30-ish patients a day down to 4 or 5 a day. Oh wow. Right. And this was early on in the pandemic when we didn't know what was going to happen, or people were staying home and they were more or less staying healthy for those first several months. And then all of a sudden it started to kind of influx, and we had different procedures for COVID compared to those that were coming in for their primary kind of walk-in needs. Anyway, so it just opened my eyes to say what else is out there. It was a great time for transition as far as kids moving and life. So then I started looking elsewhere. We were actually going to move down south. We've been talking about that a little bit lately, but I was looking at North Carolina, where I had a sister-in-law who was living down there and was actually down there searching for homes because I had a job offer down in North Carolina. And then I found Rejuve. They had a posting, and it's like, well, that looks just about perfect. We're working with orthopedics. They worry about how the body is working, the health and the nutrition, and getting someone back to a healthier person versus just kind of treating what we come across on a day-to-day basis.
Wow. So where did you come here from?
So I was in Fergus Falls, Minnesota, just prior to coming here to St. Cloud. Yeah,
Okay.
my wife is from Battle Lake area, so she was
Okay.
kind of in that region. So that's what
Yeah.
got us to Fergus Falls.
Okay.
Yeah, so it was a bit of a challenge to even get her to move this far away
Yeah.
from home. But when considering we were almost to North Carolina,
Yeah, it's closer than North
St.
Carolina.
Cloud wasn't that far away, so I was able to convince her.
Awesome. Okay, very
Yeah.
cool.
Yeah.
And here at Rejuve, now you're doing more of the non-surgical orthopedics.
Correct.
Okay.
Yeah. So everything that I do now, and I shouldn't say everything, but primarily is orthopedics based. And orthopedics is a little bit loose because orthopedics is how the body moves. It's the bones and the joints.
Yeah.
But so much of that relies on the pain. So we're kind of like a blend of kind of orthopedics is bones and joints, where we have kind of this mix of pain specialists along with bone and joint, but they're kind of mutually exclusive, or mutually inclusive. They're both happening together. You're going to have pain that's going to affect how your joints move. Your joints moving affects how much pain you have, and then that's what we have here at Rejuve is bringing you into the picture as well as physical therapy. So we have, the physical therapy is the other piece where, having it right here on site, we can just have our patients see me. There's not very many patients that get out the door without a physical therapy referral. Not that it has to be here. If something is more convenient elsewhere, that's great. But that is the big piece of the puzzle that can really get people feeling better.
I think it helps a lot with continuity of care too.
Oh,
absolutely.
100%.
Yeah, a lot of the patients that see you, then they'll see PT and they'll see us. So it's really nice to just have that inter-team collaboration.
Right, and they know that everyone in the clinic kind of knows them and knows what's going on. They see a friendly face when they come into the door. They're like, oh, yeah, Mike, you're here again.
Yeah, exactly.
So, and not in a bad way. Mike, good to see you again.
Yeah, exactly. Yep.
Yeah.
The front desk staff know the patients. We all know the patients. It's a good experience, I think, overall. Yeah.
Yeah, wonderful.
Yeah.
So let's hear a little bit more about the functional med side.
Yeah. So my
about
journey.
you.
My journey to functional medicine, kind of like you. It was I was in undergrad at the U, thinking, oh, I'll go to med school, and then actually, my husband and I got married, got pregnant with our first kid, still in undergrad, and it was kind of, I didn't really want to go the med school route at that point. I knew I wanted to be a mom, so I started thinking, what am I going to do? So I did my undergrad in kinesiology at the U.
Okay.
After that, went on to do the Bachelor of Nursing, knowing that I wanted to be in a provider role, not medical, MD, but then thinking, well, a nurse practitioner would be a good route, but first I needed to go ahead and get my bachelor's in nursing. So did that, went on to do my doctorate in nursing, and then I'm like, I don't really like traditional medicine. It's not really my jam. I worked on a trauma neuro floor, and I just saw a lot of patients coming in not getting better. We would stabilize them, discharge them, and they would be back because they weren't really changing their lifestyle. And it wasn't their fault. They just really weren't educated. It was like, oh, we'll start you on this new med, stabilize you, and then we would see them back. We saw a lot of repeat strokes, a lot of diabetes issues that were really, really modifiable by lifestyle factors.
Yeah.
And then having that background in exercise science, when I was an undergrad, I worked as a personal trainer, so did a lot with exercise. And then I also did a minor in nutrition, so learning a lot about that. So, I saw the posting for Rejuve, actually my first job as a nurse practitioner, and I thought, wow, that's incredible. They have a gym, which is awesome. They have orthopedics for pain. They have PT, and then they're really, really using functional medicine to address more of that root cause.
Right.
So I had kind of like you, a different job offer at the time, saw this come about and fell in love with it from when I walked in the door.
Yeah.
I'm like, these people are actually changing lives. This is incredible because there's not a healthcare facility where you have all of that under one roof that I've seen.
Right.
And I remember initially coming out of school, my husband asked me, so what would be your ideal practice? And it was this, not even knowing it existed. So when I found it, I'm like, this is amazing.
Yeah.
This is where I need to be.
Yeah.
So then got hired here, did a functional medicine certification. I had some of my own background knowledge, but then really just doing the certification for more formal training.
Yeah.
Went ahead and did that, and then actually became a member of A4M, which is more of the longevity piece. So I have a lot of patients now who, of course, they have chronic health issues. We're trying to address the root cause of gut issues or autoimmunity. Chronic infections like Lyme, Epstein-Barr, or they're just tired, or they're stressed, or they don't sleep good. I mean, really, everybody can benefit from something in functional medicine.
Yeah.
Then when we get to them to that point where they're like, I feel great, my stress is great, energy's awesome. Then I go more into that A4M, the optimal healthy aging, and really that longevity piece. So it's kind of fun. I've started to integrate that more after a conference that I went to in December.
Wonderful.
That has been super awesome because I do see a lot of patients, they come in, they're like, I just want to age in a healthy way. I just want to live my best life. I don't have any complaints. So that gets really fun too.
Yeah. Well, it's great that we're doing this because then I get to learn more about what's actually going on over in functional medicine as well. Because I have my own set of patients why I want to send them to you.
Yeah.
But to hear a little bit more about what you're actually doing on that side.
Yeah,
it's great to hear.
And I really love getting the ortho patients too because I get to figure out why are they having that pain. Like, a lot of times it's widespread inflammation from modifiable things, or a lot of times we'll find an autoimmune disease that no one's found. So what I love is we really get patients a lot of the time who have been through the traditional system.
Right.
They've seen the specialist. They're not any better. I have a lot of patients with even, for example, rheumatoid arthritis, and they're on the biologics, still having pain 7 out of 10, and we help them get better. So it's so rewarding. But we love having you guys too because you guys take a different approach than they've experienced. They're like, I've had, whatever injections, and they don't, they feel better for a little bit, but not long. So we love being able to have you guys too.
And that's what, injections are that. Not often are the injections going to be the thing that actually fixes you. It has to be that all-around approach. And we have some of those patients who don't necessarily get better. And it's not a blame game that, you're not doing everything that you can, but there's sometimes those pieces that they're missing that isn't pulled into that entire circle of continuing to get better. Like we're kind of, we're a tool to be able to help them feel better. And their body is a tool that has to be kind of, but optimized to be able to get it to go in the right direction too.
Yeah. Oh, absolutely. A lot of times it's just, they genuinely don't know. It's nothing patients do wrong. They just need the education. So it's so fun to be their partner and, meet them where they're at. I can have the same patient or 2 different patients, same disease or whatever it may be, and their treatment plans are completely different.
Right.
Some people, they already have made all the diet changes, and there's other things that we need to do to uncover. So it's pretty
I'm sure
cool.
that there's a ton of people that come in that are already, they know about functional medicine, they know about supplements, they have a good grasp on what they're doing. They just kind of want someone to come in and help guide them through those changes as well.
Absolutely. They're like, I'm taking these supplements. Are they the right ones? So just really being able to fine tune that.
Because there's so much information out there. You can look at, 5 different studies and have 5 different answers on what's going to be the best thing for you.
Oh, yeah. I'm sure it's the same in ortho, too. Even for me, sometimes it gets overwhelming. I'm like, wait, this article says this and this says this, but then you take it and apply it to different patients, and it just is different. It's a different treatment plan. And
so a very individualized per person. And I think that's what functional medicine really focuses on, is that it is for you. It is not just, it's not a hypertension patient, a high blood pressure patient. It's Shelby. What does Shelby need?
It's not, you have hypertension, we'll start you on some lisinopril, see how it goes. It's why are you having hypertension, and what can we do modifying your lifestyle to go ahead and change that or add in a supplement. We do use medication sometimes for sure, especially if they're necessary, or we'll try to reverse or change modifiable things to go ahead and get them off of those medications if able. We do prescribe them sometimes, but we try to avoid it if we can. Or if it's a cost issue as well, using supplements versus medications. Sometimes medications are the better option for the patients. We try to keep it as cost affordable as we can do.
And again, that's kind of, part of the person is where are they sitting financially, because you can't strap someone for cash, because then that adds extra stress within the body, and that stress obviously feeds the inflammation and the kind of the ill feelings within the body.
Yeah. Sometimes my patients, I'll ask them, I'm like, is it more stressful for you to eat gluten, or is it, what's the bigger stress? Because sometimes it's so stressful to make those changes that it's honestly not worth making that change, and we have to find other things. So I think that's where it's nice to have providers, functional medicine providers, guide the patients, because like we were saying, it gets really overwhelming with all of the different things that people can do and hear about. Absolutely.
Great. Well, I think this was a great first podcast, getting to know each other and kind of our roles even a little bit better. I learned something about you, and I'm sure there's, at least
I didn't know you were in urology.
Right? So it was great to do this. We'll do it again next week, where we're going to talk, dig much more in depth into functional medicine and how that can affect people's lives.
I'm looking forward to that. I'll dive a little bit deeper into who can functional medicine help. What do we do? How can we meet patients where they're at? Just all
how
about
to get
the whole
started
process.
with it as well.
Exactly.
Sometimes that's the hardest part, is just to go and do it versus what you actually do afterwards.
Absolutely. I think it'll be great.
Wonderful.
Looking forward to it.
Okay. And then with we'll have a comment section. You can click on a link below for more information. I believe we're going to be on a lot of the social media things out there, so like, subscribe. Hope you were entertained.
It's been great.
Thank you.
Awesome.
Please note that the opinions expressed in the Wellness Warriors podcast are those of Shelby, Terrence, and their guests and are meant to be educational and informative. This podcast is not intended to provide any medical advice or replace the guidance of a qualified healthcare professional. If you have specific concerns about your health, we encourage you to schedule an appointment with us by calling us at 320-217-8480 to discuss your individual needs with our team of experts. Remember, always consult with a healthcare professional before making any changes to your lifestyle or treatment plan.